Hi, this is Andrea Kane, and I'm here with you for HIT 445 Quality Management. We are still on week 4, but now we've moved on to chapter 17. This is about implementing effective information management tools for performance improvement. If you want to follow along, we have moved on to page 347 in your book, 347. The objectives for this chapter are to evaluate reasons why contemporary information technologies are important to quality improvement, use information management tools that are commonly used in PI processes, examine current developments in HIT that enhance performance improvement activities, at least that's what's anticipated for the future, and explain how information resources management professionals can help performance improvement teams pursue their activities. So, performance improvement in healthcare is a heavily information intensive activity. It's all about the data. How do you get it? Is it reliable? How do you use it? How do you track it, trend it? How do you report it? And what do you do in the end with it? PI models are based on continuously monitoring and assessing performance measures. It has to be measurable. Effective management of the data and information collected is crucial to the success of the PI process. If you can't measure it, how can you improve it? And if you can measure it, how often can you measure it? How real time is the data versus is it retro? And how is it being collected? Is it being accurately collected? All those types of things. Is it patient specific? Can you do some comparisons? This reminds us of the ARRA and the piece of that we have studied so much, high tech. If you remember back last semester, we had HIT, oh goodness, and it's going to escape me and I'm sorry for it, but it was health information systems. And we studied a lot about this and we really dove into IT systems and what they could do and all of that. But if you remember, ARRA brought in financial incentives to get hospitals to move from paper to electronic. And the thought behind that was that if they moved to an electronic system, an EHR, it would improve quality because information would be gathered on a consistent, standardized basis, and then you could do all sorts of comparisons and that sort of thing. Information governance, and I understand you have a class in this that is specific to information governance. I had been covering this in some of your classes, but I'm not going to touch too much on it since you actually have a class in this. But anyway, here's the definition according to AHIMA. And then there's an adoption model list of competencies. Again, I'm going to defer on this to your class. This talks about how it is a subdomain of IG and what it is. Business intelligence. Again, I'm going to defer to your class on IG for this. And then we talked about data repositories and information warehouses in our class last semester. So this should be all familiar information to you. We see a lot of video conferencing now. There's a lot of messaging with telehealth. So that has come to fruition, especially with COVID. COVID's really pushed that along quite a bit. Telehealth was originally created for rural communities to be able to have access to specialists and healthcare that they wouldn't otherwise have access to. But of course, it's expanded way beyond that. There's now even remote ICU telehealth activities, and there's also remote robotic surgery telesurgery activities that happen. Well, getting back to this, we know about comparative performance data, and there's such a thing as information resources management professionals, and these are the ones who get involved with information as a resource within the organization. So you have health information service managers, information system managers, or knowledge-based librarians, whatever they choose to call it. And that is it for chapter 17. I will be back shortly with chapter 18. Thanks.